We begin with the extreme caution across this country tonight. Doctors and emergency rooms on the lookout for Ebola.
The fear of Ebola in affected countries and beyond is palpable. A man in
Ebola outbreak. The CDC is raising its alert to the highest level as it monitors the spreading virus, keeping a close watch for cases here in the U.S.
And now, an update on the Ebola virus. The 2014 Ebola outbreak is one of the largest outbreaks in history and the first to be located in West Africa. So far, the affected areas are Guinea, Liberia, Nigeria, Sierra Leone, and now Congo. There has been over 1,400 cases of the reported Ebola virus, which has led to death. The head of the World Health Organization says that this outbreak is moving faster than our efforts to control it. On August 4th, CDC deployed 31 more workers to the affected areas. So far, there has been 100 Ebola-affected workers and half are dead. On August 5th, a Level 3 travel notice remains in effect for Guinea and Liberia, advising people to avoid unnecessary travel, which is still up today. In attempts to quarantine the virus, Liberia has now closed their borders to the public, saying, quote, "Nobody is coming in and no one is going out." CDC is rapidly sending more disease control experts to the 5 nations that are currently reporting to have the Ebola virus. The workers are now educating the general public on how to avoid the Ebola infection, which some refuse because they believe it's a way for the government to control them. CDC is also reporting that the effort to control the outbreak can take up to 6 months. Back in the States, the 2 doctors who were said to be affected by the Ebola received treatment from an experimental drug called Zimap. Medics still do not know what role played in their recovery.
Ebola. What it is a severe, often fatal disease in humans and non-human primates, such as monkeys, gorillas, and chimpanzees. Ebola is transmitted through direct contact with the blood or secretions of an infected person, or exposure to objects that have been contaminated with infected secretions. Typical symptoms of Ebola include fever, headache, joint and muscle aches, weakness, diarrhea, vomiting, stomach pain, and lack of appetite. But patients may also experience rash, red eyes, hiccups, cough, sore throat, chest pain, difficulty breathing, difficulty swallowing, or bleeding inside and outside of the body. Patients with the fatal disease usually develop more severe symptoms early during the infection and typically die between 6 and 16 days of complications such as organ failure. Non-fatal cases usually include a fever lasting several days and typically improve in 6 to 11 days.
This year's outbreak began in March, and as of August 21st, the suspected and confirmed cases has moved up to 2,473 people. The number of case deaths has totaled to 1,350 people. This is a 55% death rate, and this percentage can rise if proper precautions are not taken.
I'm with Jacques from Sierra Leone, and he has agreed to talk to us about his opinion about Ebola. So, what is your opinion about Ebola?
I do not believe Ebola exists.
And are you worried at all about your pet monkey giving you the disease?
My monkey, his name is Alob, he is my pet. He does not have Ebola. If he had Ebola, I would be infected as well.
Well, don't you know that they're finding Ebola in monkeys and in bushmeat that you eat?
I eat bushmeat every day. It is good for us. It is good for the people of Sierra Leone. If they had Ebola, we would all be infected here. There is no Ebola in Sierra Leone.
The CDC now urges to all United States residents to avoid non-essential travel to Sierra Leone, Liberia, and Nigeria. Since there's really no way to screen for Ebola at airports, all we can do is look for fever, since it's a sign of Ebola. If a passenger is presenting higher temperatures than normal, they will have to take a blood test. TSA agents are on the front line, funding, stroking people's private parts during invasive searches daily at airports to decrease the chances of Ebola spreading.
Ebola, Ebola. touch your friend. No touching. No eating something dangerous. Ebola. Ebola eater. Don't touch your friend. No kissing. No eating something dangerous. Ebola. Ebola eater. Don't touch your friend. No touching. No eating something dangerous.